Hello. I'd like you to briefly introduce yourself and describe the work you are doing within the context of your organization and of this conference.
Okay. My name is Io Chatzivaryti. I'm the member of the Social Pharmacy Social Medical Office of Kavala. And I'm here invited by the Council of Europe to present our activity and the future of our network. I will briefly present the structure. The Social Pharmacy Social Medical Office is a structure founded by 3 NGOs and 2 public services, specifically aiming at providing free medicines and free examinations to citizens that have no access to health insurance, to immigrants, to people, to homeless and people handicapped without help at home. This structure operates by the offer of medicines from the citizens and the public institutions or legal entities, and the voluntarism of the local doctors and pharmacists. Their work is being assisted by the municipality, just providing them the space and the capacity, like the furniture and the software. This is an activity already run for 10 months now, and is one adopted by merely most of the Kavalas of the Greek cities now.
How was the response of the citizens after the social pharmacy was initiated, and how has the situation changed since then?
Well, when we started designing the structure, it was just about the crisis began. So people were still a little bit skeptical about the future of the structure. But later on, and as the crisis was being immensing even more, people started responding. They offered their volunteering work, and even more, the people that are beneficiaries started being addressed more easily to us, even without campaigning that much about the structure, and even without feeling of the loss of dignity.
Did your model serve as inspiration for other initiatives in Kavala?
Yes. The work done in this structure consolidated a very strong network. A network merely consisted by grassroots level actors. These ones, seeing the response of the social pharmacy and of the people embracing the activity, starting planning for them. Starting planning for the new emerging needs and for the new gaps in the social welfare system at our state. Meaning that after that we founded the social grocery shop, which is something like a communal supermarket, let's say, where beneficiaries can shop from food to clothes to books to shoes, whatever. And also we applied for funding for the shelter for abused women, which is also an emerging trend. During crisis, we have increasingly amount of incidents of violence, domestic and feminine. And now we have applied also for an integrated social provision structure, combining all these and adding some more, meaning besides the grocery shop and the social pharmacy and the abused women's shelter, we also added now a time bank, a communal garden, and we're also thinking about free meals provision service.
Besides people in your locality, besides regular citizens, who else is your ally? Who is supporting you? Is help coming from local administration or from other movements within Greece or abroad, or organizations?
As I explained before, because the crisis is accelerating so rapidly, people are just offering services, good, their time, which is very important, meaning that the sense of solidarity is so important that it doesn't leave us gaps in operation. meaning that we have so many volunteers that we don't have to worry about the daily shift, for example. We don't have to worry about the offering of medicines because people are just keep on offering. I don't know if this is going to start, is this going to end, or if it's going to have a, like a decline. But for the moment, it's enough because all you need is the time offer. If people are offering their services, you don't need anything else.
True. And what do you think will have to happen next for these things to become mainstream, not only in Kavala but in other localities? What needs to happen, and what will have the biggest impact?
Well, mainstream is a very difficult notion when it comes to voluntarism, because when you start funding already functioning volunteering structures, then volunteers start being, let's say, feeling in excess. When our preoccupation is that if we mainstream something like that, most probably you will start alleviating the structure, and of course threatening its success. What I think, what we have seen already, is that the only thing that can assist right now in terms of mainstreaming, let's say, is having support in capacities. When we are in short of electricity or of software or whatever, then the state can come and fill this gap, fill specific gaps when it needs. When it's needed. I think that's my only advice. What I have seen to work so far.
Thank you very much, Io. Thanks for your time, and I hope
you very
you have
much
a good
too.
time. Yeah, thanks.